Hi, welcome to the Ellis Talker Show. I'm DV LeBron. Today, my very special guest is Miss Monica Sanford, who helps with VA claims. She is a doctor in nursing practice. How you doing, ma'am?
Good. Thank you for having me. This is
So,
amazing.
thank you. I apologize for the tech issues we were having. StreamYard was not cooperating. So, ma'am, I wanted to have you on and talk about VA claims, the do's and don'ts, because, there are a lot of do's and don'ts when dealing with the VA. But
Yeah,
first,
definitely.
I'd like for you to introduce yourself to my audience.
Cool. I am Monica Sanford. I am a doctor of nursing practice. I'm acute care nurse practitioner. I've done cardiology and inpatient, hospitalist, critical care for altogether about 25 years. and and then I'm also a VA disability claims provider. So anything I talk about today is literally from a provider standpoint. I don't have anything to do with the ratings except how well I can chart type thing. But anything, and I've been married to a Marine for almost 35 years. So
Oh yeah, that's a lot of creds right there because married to a jarhead, that's special. But tell
yep,
him I said hello and thank him for his service.
will do.
That
You too. Thank you for
that
your
is
service. As you were
appreciated.
saying, you were his Uber.
I was his Uber. I was definitely his Uber. So you do the claims examinations for them, and like do you cover just about everything when they come in? Like if they what kind of claims are you rating them for or working on that for?
Yeah, I see everything from, somebody will come in, a veteran will come in with either one claim, or I have somebody on my schedule for Monday that has 19 claims. So I'm going to be there quite a while going over every single claim they have. So we see everything and anything. You can claim anything. Just do it. It doesn't matter how long it's been since service, definitely put the claim in. If you get denied, appeal it. So just keep reclaiming it and or appealing it. But from a provider standpoint, when you come in to see me, the main things that I'd like to share is for the veteran to, one, if they were especially in Iraq, Afghanistan, Vietnam, to have a TERA, a toxic exposure memorandum done from their VA. So they will do the toxic exposure exam or memo, and they will upload that in the chart so I have it. But then you come prepared as much as possible, come comfortable as much as possible, especially if you have anything to do with your lower extremities or your feet, things like that, because we have to take your shoes off, socks off, things like that, just to look at everything and do a head to toe physical exam. But the main things I want to let people know is I, again, don't have anything to do with the ratings, but I can't do any treatments. I have a lot of veterans ask me for certain kind of treatments while they're there, either medication changes or whatever. And we just can't do that. It is we are there to do a head to toe exam and questionnaire for your interview. But how the interview starts is going to be as soon as you sit down, we're going to go over your deployments. Your MOS is huge importance. So I want to know every single thing about your MOS. And then we just go from there, like what your diagnosis was, what your specific diagnosis, if you have one. If you've never had a diagnosis before, that's fine. We'll figure it out. But things like that. So it's literally the onset of whatever you're claiming. When did that start? Yeah,
And
things like that.
what is the the biggest mistake that you see, the most common mistakes that you see when you see veterans that are filing these claims and that are coming to you?
I wouldn't call it so much. It's a challenge, definitely. If you come and you have had a lot of either tests or diagnosis or things off base, either in service or out of service, which we've seen both, for whatever reason, if you have them at another location, just have all of those files sent to the VA so we can put them in your chart, or hand carry them. I have so many veterans hand carry them. Makes my job so much easier because I can either just take a picture and upload it right then to their chart, or at least they'll bring me a copy, and that just helps me fill out their claim so much easier. So if you have records from other places, be prepared to have them sent to the VA or bring them in.
You talked about the rating and or what not rating, that's the Navy term for it, but basically your MOS for Army Marine types, and for Navy it's your rating. You talk about what your job was. You had mentioned that. Why is that important?
Well, to me, like if you were yeah, a lot of veterans have very specific. They're occupational because when I'm filling out a claim, I put you were exposed to occupational hazards and what that occupation was. If you were an aircraft mechanic and spent hours a day either lifting heavy engines or using hand tools and just cranking on hand tools all day, and now your wrist hurt, your fingers hurt, you have arthritis in them, things like that. So the MOS is huge important if you were um, exposed to occupational exposures, environmental exposures, and of course, if you were in anywhere that had burn pits, if you were exposed to gases, fumes, any kind of burn pit, any kind of irritants, any kind of particulate matter, I put all of that in that you were exposed to hazards in some way, shape, or form. But a lot of the even pilots will come in and they didn't realize how much exposure they had to even radiation being that close, flying up in the sun all day. So I really need to know, if your MOS was something that you literally, if you were an engineer and you were building stuff all day, lifting heavy equipment, which I know a ton of service members are always lifting heavy things and always, their packs and their gear and all kinds of stuff. I want to hear all of that. And that's what I tell my veteran is I want to know if you're claiming neck, back, shoulders, whatever it is, I want to hear about your worst day possible. I don't want, that is not, my room is not where you go in and suck it up type thing. It
Yeah.
is, I want you to go in and tell me your worst day living with whatever you're claiming. I want to hear it all.
Do you see a lot of that where the veteran doesn't, like, they suck it up or they don't talk about that, or
100%. Yeah, they don't want to talk. I've had veterans tell me they were afraid to go in or they didn't want to go in because and do the claim because they were afraid that they would be taking money from somebody else. And they didn't want to. They're like, people, there are veterans out there that have a lot worse than me. They need the money. So everybody's going to get their pay. So you getting a pay doesn't keep somebody else from getting paid. So, but yeah, they will come in and still be kind of stoic, and I'll have to drag it out of them. And I'm just literally going, I need you to tell me everything right now today so I can put it on here. But they don't
how
want to. They don't want to seem weak, or they don't want to seem like that it bothered them.
that sucks because
Yeah.
there's a lot of, they've been exposed to things, and they have to talk about those things.
Oh
They
yeah.
have to, it's part of the claims. Now, how important is it for them to tell you how it is they're treating their ailment?
Yeah, I'm so glad you said that because the VA is very. I will submit a claim and then they'll send it back to me and say something to the effect of, well, if it was so bad, why didn't they seek care after they got out of the military? If they don't have any records in the military while they were in service, we can tell, we can look back and see that why they didn't claim something. A lot of veterans don't claim because they are afraid they will lose flight status or hazard pay or any kind of status that they're on, deployment status, anything like that. They don't claim stuff because they're afraid they're going to lose their job or their pay or their status. So we work that in, but I still tell the story of how they got hurt and what happened when even if you were you're in service and you go off base and you get in a car accident or something off base and it wasn't a training exercise, all of that counts. So you're still in service. So you need to tell us everything. But then, they'll come back and say, okay, well, why didn't they get care after? And a lot of it, have an answer prepared for that, meaning it was because you weren't around. It didn't meet the level of emergency care, or you didn't want to go to be seen at primary care because of the cost, or you didn't have any more insurance, or whatever it is why you didn't be seen. I have a lot of veterans tell me because they're going to give me Motrin and tell me I have to have surgery, and they don't want that. So it's
Mhm.
they want. I mean, we hear everything. So just think about it and go, this has really been bothering me. But I also have veterans that bring in their spouse, and the wife is going, I've been telling him for years to go be seen, things like that. And that is a lay statement. Have your spouse, have your buddy, have anybody write a lay statement, say she's been claiming this or complaining about this for however long.
How
That's
important are those statements?
100% important. I put it in all of my, anybody that brings me one, I put it in my documentation, put it in my submission, because that's just gives me more evidence to build my diagnosis. But so how it's going to go is we're going to ask you, when was the onset of whatever you're claiming the diagnosis? Do you actually have a diagnosis? And a lot don't. They've never been diagnosed with something. So I may be diagnosing you right there and saying they meet the criteria for this. Um, so, do you have a diagnosis? When did it start? When were you seen? Were you given anything in service or out of service, meaning physical therapy, medication? Did they tell you need surgery, or did you have surgery? Things like that. But if it was during service and you went to be seen at a clinic and had um, you were on light duty, something to that effect, that is huge important to us. So that is, everybody says the nexus letters and the nexus. We're just trying to build a pattern that shows this was the injury or this was the original claim. And sometimes people were in war somewhere. People were in, they were deployed places that you don't have a clinic. You can't just go, if you're out in the field in Iraq, go to a clinic and they're like writing notes and taking X-rays and all that kind of stuff. They
Yeah.
just don't have the documentation. So that's where the stories are huge, and buddy letters, things like that.
Which records did you find are most effective? Like, if let's say that the veteran was getting treatment, and
Yep.
what is the difference between they're getting treatment through VHA or they're getting treatment through a private provider? Do you see that the notes are better or more thorough for one side or the other, or it doesn't really matter from what you've seen?
I've seen both. Some are very thorough on one and not on the other. Some are, however, if it's documented, a date, a time, a chief complaint, if you go in there and say, my knee, my shoulder, my lower back, whatever, and there is, I would push veterans to ask for imaging, meaning X-rays at the very least, um, and especially young men and women right now, young veterans, just getting out, get the X-rays and stuff before you get out if you can. But then, because you don't know how you're going to feel in 5 years, 10 years, and it goes by fast, as we all know. But 5, 10 years from now, when you're older and you're going, you know what, that injury really did kind of mess me up, and you can appeal or you can reapply or so. But the main thing I would request, and I can request thing when I'm documenting, and if I don't have an X-ray, I recommend X-rays. I always put on my notes, as me, the provider, I recommend X-rays to look for either degenerative disease, arthritis disease, an old fracture, anything like that. So I can recommend them. It is up to the VA if they send the veteran to get that X-ray. So if the X-ray is already done, that's amazing. But just the documentation itself that you went somewhere to be seen and your chief complaint was whatever, your back pain, your feet pain, whatever, sinus issues, and they gave you either over the counter stuff or they gave you a prescription. They did some imaging. That is, sorry, can you hear that? Huge,
Yeah.
huge
So
thundering, crack of thunder, right? It's storming here in Florida. But yeah, anything that documents like that and document a clinic note is of huge importance. So if you're
right.
still in the service, go be seen for whatever claim you have now. and ask for imaging if they can do it. Um, but I do want to say, and that if you're with me and I want to order something and I ask the VA, please order these X-rays or MRI or CT, whatever. Uh, Big ones are PFTs, pulmonary function test, or sleep apnea testing. So if I order those, it just kind of delays the process a little bit. So just be patient, because then you have to go get the test. They have to send it to me, resubmit it. I put all the documentation of the result and then redo the chart. So sometimes it takes a little bit of time, but definitely worth it.
The reason why I brought up the going to outside care versus dealing with VHA was because
Mhm.
when I did my sleep apnea claim, I actually went to a private doctor and got all the private. Now, I'm fortunate to be able to have insurance to be able to do that. But I did go to a private doctor, went, got the sleep study, wrote there. And now here's the thing, like a lot of veterans don't know, the VA tells you what they're looking for
Right.
when it comes to injuries. It's on CFR VA. If you put CFR VA in Google, you can literally, it'll pull you to page and they list everything that they rate for and how and what they're looking for. So I had a sleep apnea, positive sleep apnea, and the doctor wrote a script for CPAP, which is, a certain percentage there. And then
Okay.
then where one of the things where sleep apnea, and I know you're familiar with this, there's been proven studies that certain medications you take, certain things that they give you, like let's say for PTSD, they will have effect on your sleep pattern and sleep apnea. So the doctor saying something like more likely than not related to his military service on a
Right.
scribe, that does help. Have you seen that kind of stuff? And can you talk about how important wording is?
Wording is everything. It literally is. As far as my favorite sentence though too to is, when I'm kind of rounding it out, is this service connection cannot be excluded. Meaning there is so many things going on with the veteran. I cannot say with 100%, reasonable doubt type thing that this didn't cause it. So of course it caused it. It can't be excluded that it caused it. Just the same with the PFTs and the sleep apnea study. Is sleep apnea, a ton of medications can exacerbate that. So for like you said, PTSD, for any kind of TBI, any kind of pain medications, any kind of, a lot of people are on different kind of sinus medications because of Gulf War exposures and burn pits and gases, fumes. If you are on a flight line, um, if you're on a flight line, working on a flight line, and you're exposed to a ton of fumes and the fire foams and all of that kind of, and the cleaning things, that is a huge claim, is sinuses, and any kind of, the occupational exposure, like I said, the environmental exposures with sand, dust, the things like that, but also skin, anything having to do with your skin. And why I'm saying that, there are certain medications that people are on for sinuses, for skin things, that can have an effect on your sleep.
Now
So,
you
and we
Yeah.
have to put that in there.
Yeah, no, and you know what? We're kind of skirting around it, but I want to ask you, how
Yep.
important are secondary conditions? Because when a veteran is trying to get rated, or you're trying to get help from
Right.
the VA on that benefit side, they're filing claim for this and filing claim for that, and I tell them, look, there are things that if you're rated, there are secondary conditions. That means that the condition was exasperated or caused by, like for instance, if you've had back problems, right, and you have sciatica down your leg, that's radiculopathy, and
Right.
that's a secondary to that. Can you talk to my audience about secondary conditions and how you tie them in your practice when you're doing like the DBQs and stuff?
Yeah, just like you said, it's that they hopefully, best case scenario is we have some kind of documentation that you went to be seen for your back issues and had um, some kind of imaging for your, either a clinic visit that said, I hurt this while I was on, uh, some kind of training exercise, or I was out doing physical fitness trainings or whatever. And now I had lower back pain, went to be seen. They gave me Flexeril and Motrin, which they give everybody, and did, yeah,
Nice.
and did at some point, hopefully they said, here's your Flexeril, here's your Motrin, you're off, light duty for 2 weeks or whatever. And they did some imaging, hopefully. That right there tells me one date and time. And then the next thing that happens from that is either, like you said, the radiculopathy, any kind of, I also, if there is a, one knee hurt and then all of a sudden the other knee starts hurting from overcompensation, I 100% put that. So you can tie the two together and make it, not make it, it is related. So one condition can definitely cause another condition. You can definitely have more than one condition at a time. But hopefully it is documented in a way that this one started first and this one came secondary. So,
And that's how you kind of tie them together.
That's how I tie them together. It's a, kind of a documentation thing. And the studies that we pull are based on secondary, that this one was caused by, when I pull documentation, it's usually from scholarly journals. And they're all from NIH or, some kind of scholarly journal, orthopedic journals, neurology journals, things like that, that show this can definitely cause this, or it cannot be excluded that it was caused by that. So the thing, even going into all that, I want to stress to any veteran out there, if they do not think that their provider is listening to them, make them listen. Tell them to slow down, make them listen, or say, I want another an appointment because this one was 10 minutes. My appointments, I will take up to an hour with each vet.
Wow.
Oh yeah, easy. And sometimes more than that. The one on Monday where I have like 19 claims or whatever she did, the veterans coming in with, it's going to be, I'm going to I requested a 3-hour time slot. So I take all kinds of time. That's why I tell you, be comfortable. Hopefully you will be seeing somebody that has, takes the time with you and
Yeah,
can
no,
connect all these.
from what I've seen, and there's been those horror stories where they walk in for a CMP exam, and it's like in and out 5 minutes,
Oh
and
gosh. Oh gosh.
that's sad. That's actually when I first went for my first CMP on my back. That's how it went down. Like
Oh
it
no.
was it was just and of course things weren't too favorable then, but they ended up being favorable later. But you had mentioned about medical journals and putting that kind of stuff. Can
Mm-hmm.
you talk about the importance of that?
Well, when we're doing I put them in, even if there's two different, a few different DBQs, but they're asking for a medical opinion, we have to put, I I don't know if all I have. Let me put it this way: I have seen other providers' notes that they don't go to medical journals; they will just go to some website. I do it with a medical journal that's been studied, that has different kind of studies in them that show what the claim is. Anyway, but the using of the journals, I also use those. I used them today charting, and it wasn't for a medical opinion. However, I gave my medical opinion because that just put more weight on the submission that I was putting in. They weren't asking for my medical opinion, but I needed to put that in there to make the entire claim kind of come together. But that also comes down to the story, the time. Again, an aircraft mechanic constantly using their hands for small tools and things like that, and now all of a sudden can't use their hands. I go and look for medical journals and put the relation. It's not just their pain and inflammation and this and that. I use all the documentation I can. I use all the journals I can to make that story pop. All you veterans, let me tell you, when I'm talking to a veteran, I don't watch a bunch of movies and stuff. you veterans are my movies. You're my live stories. I listen to the stories and make that story kind of come to life if I can.
I love
It's
that.
yeah, it has to be that way to make the whole picture, to make the whole and make sure your provider is getting the entire picture. So
Thank, thank you.
let
and
me just say too, the if you have scars from anything, um, something just popped in my head about the knee I was talking about. If you have scars anywhere on your body, we're going to need pictures of those. We're going to need measurements of those. We're going to need you, wherever they are, you're going to have to drop trowel or take your shirt off. When I say get comfortable, because we're going to need to see those scars and measure those scars and take pictures of those scars and especially if you're claiming that scar. But
what
um,
you can
and
claim the scars. I didn't, that those are
yeah,
things that, yeah, and so be ready if you do have a scar from a surgery or something. Be ready to claim that too.
yeah, no, I literally just told my uncle. My uncle's a Vietnam vet, and last year at Thanksgiving, I said, "Have you done your claim?" And he had no idea. So that's the biggest thing now is veterans don't know what they're entitled to. They don't know what they can claim, how they can claim. They just don't know what they're entitled to, period. So I went over everything with my uncle, and he had gotten injured in Vietnam with a huge scar down his back. And I said, yes, you can claim that scar. You can claim this, that, and the other, whatever. So he claimed a bunch of stuff, and literally, it's taken 6 months, and he's just now getting his first checks. But
Wow.
yeah. So I was like, I just saw him a couple days ago, and he was literally going, I can't believe I waited so long to do this. So don't wait. Get started on it. Get all your kind of ducks in a row and as much documentation as you can. And when I say documentation, it doesn't have to be medical documentation. It can be write down everything you can think of that you were exposed to, that you did when you were in service, that you did with your MOS. Just write it down, little narrative note or little bullet points. So when you come to see me or your provider, you can just, go right down the list and say everything. It just makes it flow because
Yeah.
when you're in there, veterans don't remember sometimes.
Yeah, you get the kind of the shock, and you're not thinking
Yeah.
about things, so it's better to go in prepared. Now, before I close out, the PACT Act, can you kind of briefly talk about how that's affected your practice and some of the things that you've seen when it comes to the PACT Act?
Yeah, definitely. It was legislation, great legislation that passed last year that has passed, helping expedite a lot of claims that would have taken a longer time, put it that way. That is a lot of the uh, presumptive services for Vietnam, Agent Orange, things like that are automatically kind of covered under certain respiratory issues, sinus issues, and then of course for Iraq and Afghanistan. So we get veterans coming in under the PACT Act. I will say since the PACT Act now, a huge kind of influx. So bear with everybody. We're trying to get everybody scheduled for their exams and get these charts in and get them rated. So it's kind of this huge influx, but they did hire a lot of people to do all this too. But the PACT Act specifically says if you were exposed to the burn pits, sand, dust, anything while deployed to Iraq and Afghanistan, even vehicle fumes, gases, and this is why the TERA, TERA memorandum is so important. Just go to your va.gov, go to your nearest VA, go to your VSO, and ask them for a TERA memorandum, toxic exposure report, and they will go over everything that you were potentially exposed to, your MOS, where you were, and verify your deployments, things like that. It's just a huge help. But also, I need to say that make sure you also go in telling when I say your worst day ever, what that looks like on your functional impact, daily functional impact. If you are hurting your shoulders, arms, legs, whatever, and now you can't go grocery shopping, walking around the grocery store, you can't drive long distance because you can't lift your arm, things like that, or you can't travel, or you can't lift your kids, or however it is functionally impacting you, And that's a lot of the things I hear with veterans when I'm talking to them. Those are the things they don't, that doesn't come straight to mind. And I'm like, I want to hear everything. Does it hard for you to grip your toothbrush in the morning, or you shave yourself, or brush your hair? Whatever those little things are that irritate you, write them down, bring them in.
How often does it incapacitate you?
At
That
100%. Yeah.
like that is part of the way the VA looks at it. How
Yep.
often, how many incidents do you have in a week, in a month, and those kind of questions are stuff
Yeah.
that the VA definitely looks for.
Yeah,
Uh,
your worst flare day, that you have to kind of crawl into bed, and if you have migraines, but there's migraines, sinuses, different kinds. You can claim anything. So just write it all down and go to your VSO and start telling them head to toe what you want to claim.
Excellent. Well, Monica, look, it's unfortunately we're coming to the end of the show, but I do appreciate all the info you put down, and then having the patience earlier. On my show, I love to give my guests the last word. So go ahead and speak to the people of Ellis County and the people who watch my show.
Hi, well, thank you for having me on. This was amazing. Anytime I can talk to veterans, I love talking to vets. We are in Pensacola, Florida. Me and my Marine husband of 35 years. He's usually the co-host on my show, the Monica Sanford Show on Spotify, iHeartRadio, and it just got picked up for national for Reese Across America Radio. So catch it somewhere. I know, that's great. And so I can go to all kinds of veterans. So thank you so much for having me on. This was great. And file, go to your new. And let me say, a lot of veterans don't know what other things that they can qualify for. I'm talking about, break on your taxes, things like that, loans. Go into your VA or go to va.gov, but definitely go check out your nearest VA.
And Texas provides a lot of those benefits. I've had Texas veterans on the director of that
Oh,
and
cool.
Texas Veterans Commission, and he talked. I mean, he went on for more than 5 minutes about some of the benefits that Texas offers.
Yes.
So if you're
Yes.
here in Texas, make sure you look at that, brothers and sisters. Again, thank you so much for coming on. Can you stick around after the show real quick?
Yeah, definitely. Thank you for having me.
Thank you. Bye.